Let's talk about what today told us about the state of play with public health. Now, one of them is a friend of the show you know very well, Dr. Drew Pinksky. Great to have him. Another one is a PhD doctor, okay, a researcher on this who I have been wowed by on Instagram, okay? Her name is Dr. Jessica Knurick, and I have been stealing her stuff. Did I say that out loud? I have been stealing her stuff and analyses for a long time, Drew, because there's a real intelligence to it. Doc, it's good to have you here. You can find her on Instagram. We'll put it on the screen. But thank you for joining us, and I've appreciated what you've been doing. Now, let's talk. Dr. Drew,
Yes, sir.
I don't think it's worth me taking your time with how did Bobby do. I think Bobby acquitted himself well. I think he's got hard and soft areas. But what do you make of the premise that there were central concerns that were reflected by both sides today?
I saw nothing but confusion on the part of our representatives about how healthcare works and what the federal government relationship is to the healthcare system. Public health is not healthcare. The physician is responsible for doing whatever is in the best interest of the patient in front of him or her, and is at their liberty to use any and all available resources, completely independent of what the federal government thinks, what the CDC thinks, what the FDA thinks. These are advisory only. And this idea that the CDC is an organization that is thus saith the Lord is a complete misrepresentation. They make recommendations. The insurance companies create a scam on those recommendations. They use it as a way to justify whether they cover something or not. But the recommendations are just that. The physician is at their liberty to do whatever they wish.
All right, but Jess, that's kind of the point, though, right? Is that's what the lawmakers were arguing, that you shouldn't be taking things out of the capabilities of doctors by saying, you know, none of these vaccines can be used for different kinds of people and make it hard for them to get them. You should leave that to the doctors and the patients. What was your read on the dynamic today?
Yeah, I mean, I think that was exactly Senator Warren's point when she was questioning him as well. You can say that, you know, that he's not taking away vaccines from anyone, but if the CDC is not recommending or is only recommending the COVID vaccine for 65 and up and people with pre-existing conditions, that leaves a lot of people who are no longer going to be covered by insurance. And if they're no longer covered by insurance, they're not going to have access to their vaccines when they go to their pharmacy. And so I think that that's kind of like it's just a loophole in terms of how they're explaining it. It's removing access from people when the CDC makes those recommendations.
Or a small sliver. Medicare still covers it, Medi-Cal still covers it, and you can appeal to the insurance company. And if your physician is motivated, he or she can get that coverage. The vaccine is available. We're talking about the healthcare system. Nobody, and I mean nobody, is talking about taking options away from physicians. What is available to us is literally anything we wish to use on behalf of the patient, including any and all available vaccines.
But Drew, the question is, I get what you're saying about the agency dynamic here and the big brother dynamic. Okay, fine. But don't you think that the real battle that you're seeing on the right and the left is that, hey, you guys don't want people to believe anything but what you suggest in the moment. And when it comes to vaccines, we have something called science. There are things that are known that are not a matter of opinion, and those should stand. And on the extreme, Maha tends to put everything in the same bucket.
I don't know about extremes. All I know is that we didn't have the data to recommend the boosters, not the Alpha and Delta, the booster to 6-month-olds. We just don't have it. And also, why are we giving hepatitis B to 1-day-olds? There's just no data to support that. I don't know what we're doing. Once they explain that, once we have the data, well, now we're back in the scientific realm where we can trust the material being published. But as it is, the public has lost trust. You are right. The truth is meaningful. And science is an attempt to get at an approximation of the truth without any ideology, without any politics, without any encumbrances of pharmaceutical company or finances. And the problem is there's been a hand on the scale for quite some time, and things have been done that literally don't make sense, including recommending a vaccine for which they can get it if a family wants to get that vaccine, they should. But recommending it because based on available data, we don't have it. I boost all my 65-year-olds plus. Absolutely. The data's there.
You're talking just about the COVID vaccine. You're
Correct.
talking about the COVID vaccine, and that's one issue, but I'm just saying they all get thrown in the same bucket. You have the guy in Florida
Why?
standing up and saying, no vaccines are
No,
going
he
to be
said
recommended.
no
None.
mandate. Chris, he said no mandates. Do you have the
He said they're not
bioethical
going to be
standing?
required. Drew, hold on,
Mandates.
Drew.
No
Drew,
mandate to go
Drew.
to
I'm going
school.
to
Not
bounce this to
required to
Jessica.
go to
I know,
school.
Drew, and you're telling me that you think as a question of science, and I'm going to let Jessica answer it right now because she's more qualified, but if your position is, oh, yeah, you don't need to make kids have to take certain vaccines to go to school, it'll be okay, just leave it to their doctors. I don't buy that at all, and our experience doesn't buy it. But, Jess, you give your take, and then Drew can respond.
Okay.
I mean, I think this is interesting that this happens all the time. What a lot of people will do is they'll say, oh, we don't have the data, we don't have the science, kind of relying on people to not know that we do have a lot of good data to establish these recommendations. I mean, Dr. Drew brought up the Hep B vaccine. Experts in that area consistently discuss how we have good data and why the Hep B vaccine is given. And I mean, even Senator Cassidy was having a debate this week.
Is the child going to go out and step on a needle? Is the child going to use IV drugs? Is the child going to have sex with a drug user? Is the child's mother have hepatitis B? No, because we test for that. Why are we giving hepatitis B vaccine? And again, bioethics matter. Bioethical standing is that nobody is harmed by what we do to them. That's a bioethical mandate. Yes, we want to protect others, but we first must do no harm.
But isn't that a projection, Dr. Drew, that you think the COVID vaccine hurt more people than it helped?
No, not if you're over 65. I helped a lot of patients with that vaccine, particularly during the Alpha and Delta phase.
You think
Not
under
in
65,
any
the
group.
vaccine hurt more people?
If you were 20 years of age, the probability is, I would say you were more likely to be harmed than helped at age 20.
You would say, but what would you say
Where does that
based
come
on?
from?
Are you saying that based on data or just like what?
I'm saying based on the probability of a 20-year-old getting serious illness from COVID, even all the way back in the Alpha and Delta phase, but certainly in Omicron, let's just use Omicron, the probability of a 20-year-old getting severe illness from Omicron approaches zero. The probability of myocarditis was non-zero. So the risk reward was just not there. And yet it was mandated for those kids to go to school, for college. The mandate that if you want it, get it by all means. But the bioethical standing for a mandate is just not there for a lot of these things that we did very casually, where risk reward was not a proper, and there was not a proper analysis. And physicians were scared to do anything except what came down from on high, which is not our role as physician. Our role is to represent that patient in front of us in the specific, unique circumstance of that patient.
Jessica.
Yeah, I just, if this were the case, you would see major medical organizations coming out defending Dr. Drew's position. You would see scientists in these areas coming out defending Dr. Drew's position, and you do not see that. You see them coming out against everything that's going on at HHS right now and against what RFK Jr. is doing, particularly at the CDC. And so, I just think that we should we should look at the data and we should listen to the experts in these areas versus a few people on kind of the fringe calling them out.
Remember, myocarditis of a 20-year-old was called mild. Myocarditis is a dreadful illness. It could lead to a need for cardiac transplant. It's a horrible illness. And people were like, oh, just mild myocarditis, just mild myocarditis. There's no such thing as just mild myocarditis.
I know. Look, Drew, I hear you on it, but I got to tell you what's equally frustrating is when I hear all these people say that about COVID. COVID's just a cold. More people die from the flu. Especially from a guy who went through what I went through, right? And so did you.
But that was Alpha and Delta. That was a different illness. Don't get your head stuck in Alpha and Delta. I know, but they said it then too. Well, that was a bad illness. I had it too, and I still have cardiac.
Yeah, we both know.
Terrible. And I tried to get the vaccine, and they would. It was a mess anyway. But I couldn't get the vaccine because I didn't meet the right profile in California when they were early administration of that vaccine. I got COVID trying to get the vaccine. But in any event, it was a terrible illness.
And I got to tell you, I followed it, and I'm so happy you got better. I followed it. I wanted you to get well, and I said it, and I'm so glad that we have you and that you're strong as ever.
You too. But at the point I'm trying to make is that we need to not centralize authority, and physicians need to be at their liberty to make their decision and consider risk reward, which is a complicated decision. Every decision we make involves risk reward, and we have to sit and think about what's best for that patient, whatever we do, whether it's a vaccine or a medication or even talking to them. All of this involves risk. And unless we can prove that the reward we're going to get is substantially more than the risk, we shouldn't be doing these things.
Right.
That's all. It's
Well,
very
I'm with
simple.
you, Drew, and you can have your opinion. But Jessica, last point to you. It's about who gets to recommend to the rest of us what seems to make sense on the data. Myocarditis, we can talk about it, but the data that I've seen shows that risk of getting it from COVID was greater than from the vaccine, but it becomes a weaponized point. Where do you think this should rest, and do you think we're moving towards it or away where we need to be, Jessica?
I mean, I think that I agree that doctors should be making decisions, but the CDC is making recommendations that are then going to have consequences, right? And so whether insurance companies are going to cover things. And so if we're taking that choice away and insurance companies are no longer going to cover it, and many people in this country will no longer be able to have access to that in the same way, and certainly won't get it if they have to pay out of pocket, I think that's the issue here, right? If we want to give physicians choice, then continue covering it so that people can have choice with their physician.
Chris,
The trust issue then becomes, are they going to abuse the access? Go ahead, Dr. Drew.
I taught through the Department of Psychiatry and Medicine for almost 20 years, and here are words that never came out of my mouth. What does the CDC tell you to do? What does the FDA tell you to do? I might say, what's the data from the CDC? But they're not involved in medical decision making. And public health is a separate thing from healthcare, and it's been running amok lately a bit.
I get it, but we need both. We need both. Dr. Drew, thank you very much for being here. Jessica, Dr. Jessica, great to have you. The last name is Knurick. And you can find Jessica Knurick on Instagram, and I think she's got a lot of intelligent takes. Thank you for being here. I hope you come back again. I'll see you online.
Thanks for having me, Chris.
All right, 4 minutes and 35 seconds. Look, again, disagree, fine. How you disagree is everything. I kept that going because I thought it was really interesting. And I think that this is going to be a big dividing line. I'm telling you, I said it when the post came out. The president wanting a debate about the COVID vaccine is a step away from his base, not toward it. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.